And good evening, and thanks for joining us this evening here on KCAU 9, our Town Hall Coronavirus Fact and Fiction. I'm Tim Seaman, and from closing businesses to self-quarantine, the COVID-19 outbreak is overwhelming many people. That's why tonight we'll be joined by three medical and health experts to sort through the facts and the fiction. But first, let's take a look at the recent numbers concerning coronavirus throughout the United States and the tri-state area. Here in the U.S., more than 7,000 cases have been reported, with more than 100 deaths so far. The state of Iowa now reporting 9 new cases, bringing the state total to 38. Nebraska has confirmed 24 cases, and South Dakota officials now report that they have 11 cases at this time. Here in Woodbury County, there are no positive COVID-19 cases, and that is indeed good news. Joining me this evening to break down COVID-19 and the fact and the fiction are three local experts. Tyler Brock is nearest to me, the Deputy Director with the Laboratory Services Division of Siouxland District Health. Dr. Larry Voles from Mercy One Siouxland, the Chief Medical Officer there, joins us in the middle. And Medical Director at Unity Point Health St. Luke's, Dr. Mike Kcau, also joins us here this evening. And I want to start with the broad picture here. There are no positive test results, as I just said, here in Siouxland and Woodbury County. But Tyler, I guess I'd ask you first, where are we today compared to 2 weeks ago or 18 days ago, whatever that number might be?
A long ways. It's a lot different. Obviously, a couple of weeks ago, most of us probably had ball games that we were planning on going to, and social calendars and that kind of thing. And now those are all cleared out.
If I'm experiencing these symptoms, and if COVID-19 comes into my life, how long should I expect to need to stay at home? Is there a definitive answer for that?
Well, this has kind of been an ongoing development as well. But I think generally what we're talking about now is if you are someone who has it or you're someone who's suspected of having it, really what they're looking for now is that you can go back to normal routines 72 hours after your fever is gone. And that's 72 hours. That's 3 full days.
And good evening. Thanks for joining us this evening for this special KCAU 9 Town Hall Coronavirus Navigating Change. I'm Tim Seaman. From school closings to restaurants changing the way that they serve food, the COVID-19 outbreak is indeed impacting just about every area of our daily life here in Siouxland. Our goal tonight, though, is to help clear the haze surrounding some of the uncertainty that we're all facing. Leaders representing our city, our schools, and the county emergency management team all join me in studio tonight to help us sort through this information. But first, we want to take time to look at the recent numbers out just today involving coronavirus. In the United States and the tri-state area both. Here nationally today, more than 53,000 cases have been reported, and there have been more than 500 deaths across our nation. Locally, those cases, though, are much fewer. Nebraska confirming 61 cases through today, and South Dakota with just 30 positive test results. Here in Iowa, now reporting 124 positive COVID-19 cases. 2 have been confirmed here in Woodbury County, with a single case so far reported in Sioux County. And I want to take time now to introduce you to the folks that have taken time out of their very busy days to join us for this next half hour as we talk about navigating change here in our community. Closest to me, right to the left, Rebecca Socknet. She is the emergency manager with Woodbury County Emergency Management. Sioux City City Manager Bob Padmore is in the middle seat this evening, and Sioux City Community School District Superintendent Dr. Paul Gosman also joins us, and he is at the end of our panel this evening. Again, I just want to say thank you for taking time to address concerns folks have as we try to navigate change. There's no doubt about that.
In the meantime, we're doing what we can to serve our students with a meal program that we've put in place in 24 different locations. It's been open for 4 days. We've served over 13,000 meals in those 4 days. We've made resources available on the website so that some learning activity can continue at home. It's not mandated, it's not required, but it does give that option. And we want our staff to stay in touch with our students and parents and families as best as they can during this time.
tonight we turn to Jennifer Jackson. She's closest to me, the Executive Director at Heartland Counseling. In the middle of our panel tonight is Dr. Raul Sanchez from Renewing the Mind Clinic, and rounding out our group here in studio of mental health professionals is Amy Block. She is the Executive Director with Catholic Charities here in Sioux City. How big of a problem do we face with mental health in the middle of this crisis? Whoever wants to jump in.
The biggest piece is just the perception of the loss of control. So what happens is nobody figures out, like, I can still go work out, I can still cook, I can still do my things for me personally, but it's the perception of isolation and the loss of control that pins people, and they feel like I can't do anything that I used to do, and so they just freeze.
We're talking about positive things to get out, but is it okay to just go, whoa?
Absolutely. I think some of it is giving yourself permission to do that, and to know that you're not alone in that. For so many of us, we're working so hard to keep it together. Our jobs have changed for so many of us. Some people have lost jobs. Our kids are home all of a sudden. And so we're trying to figure out what's that new normal, trying to manage those schedules. And so I think some of it is just identifying what's going on, figuring out how to express that. Maybe it's by ourselves or talking it through with somebody else, and then moving forward. I think, we talked about having a routine is really good, finding somebody to talk to and not just sticking with it ourselves. Because sometimes what happens when we just sit with our own feelings is they become irrational. And so if I'm able to talk it through with Raul or with Jennifer, then they could say, oh, that's not really accurate, maybe what's going on or what those thoughts are. So doing that with somebody else can be really helpful. Making sure you're getting sleep.
Joining me tonight, once again, I'll introduce you to our panel that's with us. Closest to me, Tyler Brock, who is the Deputy Director of Laboratory Services at Siouxland District Health. Dr. Larry Voles, Mercy One Siouxland's Medical Officer and Medical Director at Unity Point Health St. Luke's, Dr. Mike Kcau on the far side. Gentlemen, again, thanks for all of you for being with us. Can I have COVID-19 and not have a fever, or is a fever mandatory? Is that part that says I have this?
Yes, several people have. There's a lot of folks with COVID-19 that don't have the classic symptoms. Okay, there's a wide range of symptoms that folks have. So, you name it, all the way from high fevers to virtually undetected fevers have been documented in the cases that we've seen, and I know other health departments have seen that as well.
We've got a Facebook question here we'll get to real quick, and we thank the folks at home that are participating tonight. Why does it seem like most of Woodbury's COVID cases are young adults? I don't know that that's the truth. That's a question from a viewer, so I'll let you decide. Is that what feedback can you give us there?
There haven't been that many
There
cases.
haven't been that many, that's right.
Right.
There haven't been that many. It's a small sample size.
Right.
So, I think nationwide the cases are all over the board. All age groups are affected. I think right now you're just looking at a small, it's probably just it's just kind of a random thing that's happened because we haven't had that many cases.
Closest to me is Jeremy Craighead. He is the Executive Vice President at Security National Bank. Jeremy, thanks for coming in tonight. In the middle, well-known face here in Sioux City in the business circles, Chris McGowan, President of the Siouxland Chamber of Commerce. Chris, thanks for being here. And also tonight with us on the far side, Lori Scott. Lori, thanks for coming in. She is the Financial and Housing Counselor at the Center for Siouxland, an organization that helps many, many people in our community. Again, give us your opinion on where we may see our community when this finally is done, when you look at the way the coronavirus has impacted businesses.
So I think first and foremost, I appreciate the opportunity to be here with both Lori and Jeremy, and thanks for the opportunity to talk about the Siouxland business community. And Tim, it was actually almost 1 month ago today, on St. Patrick's Day, we were visiting in this studio about what we thought that long-term impact would be. And we talked a little bit about how impressed we always are with this community in a crisis. And that's the case, again, 4 weeks removed.
Start to finish, from the SBA and U.S. Treasury all the way down to the individuals and companies trying to borrow funds. The process moved very quickly. It was very fluid, a lot of changes along the way. But in the end, as Chris McGowan stated earlier, a lot of normal competitors came together to help make sure that the end goal was achieved, which was to get the dollars in the hands of employers, to get those back into keep payroll moving, and ultimately put a paycheck in people's pockets.
This week we've polled our viewers about a couple of different subjects. We want to take time to look at the first of those, and some of these statistics may not be all that surprising, some may. Are you worried about your personal finances? 59% saying yes, 40% saying no. That may, I don't know this statistic, that may almost mirror when you look at a socioeconomic base of our community. It's probably somewhere in that area, maybe a little greater on both ends or less on each ends. Lori, tell us, when people have that problem, Jeremy just mentioned make the phone call. What programs or what assistance does Center for Siouxland have, or other nonprofit financial helpers in our community? What are they able to offer?
So with Center for Siouxland, with our credit and housing counseling, we're able to help clients put together that budget that might be stressful for them to do, to take a look at that budget and their expenses in black and white with the client, to be able to figure out where they might be able to cut back. Because when somebody is really stressed, it's difficult to make those decisions.
Nearest to me, the Executive Director of the Siouxland Chamber of Commerce, Chris McGowan, in the center. Joining us this evening from Mercy One Siouxland, the Chief of Staff there, Dr. Larry Bowles. Doctor, thanks for coming back, seeing you again. And also joining us tonight from the Siouxland District Health Department, the Director of Health there, Kevin Green. Kevin, thanks.
Yeah, so I think the thing that we have learned from this is I think you gain experience from treating these patients. And I think we understood that these patients could get very sick, and I don't think you fully understand that until you're really in the heat of taking care of these patients. And I think just as this has progressed, I think we learned medical treatment improvements from what they had learned from China and from Europe. And I think the longer this has progressed, as we've learned more about how to manage patients, what patients do well with treatment.
I think things we have that is the impact of some of the mass gatherings having and the implications that'll have for more cases. And I think those are all things that have evolved along the way. And the other part is that we've gone through this whole journey, and every day you have to read the guidelines again, because there are new learnings, new evidence out there that they're changing those from a national level through the CDC. So it's keeping abreast of those, because we had many conversations with entities and individuals on a Monday. By Thursday, it was almost like, do we have the time to call them back?
Checking in with our viewers to give their opinions on some different things, and viewer question as well. This is one question that we've had come in. I want to get an antivirus test. Are the tests being offered locally reliable at this point? I think that we've proven that the tests are available, and we continue to see solid data from those tests.
We're perceiving that those that want a test have the access to get a test. What's gone on with the consortium, Siouxland Community Health Center, that network of healthcare providers that are actively doing the testing. I mean, what I have now requested from our state testing system is actually a summary. And so when I look at the total number of tests given to Woodbury County residents, there are between almost 17,000 tests that have been done. And what's interesting to me is I've gone through and assessed and kind of reviewed those. Some individuals have had up to 6 tests individually. And so that's a mixture of both the positive and the negative. So it
Closest to me is Tyler Brock. He's the Deputy Director for Siouxland District Health. In the middle, Dr. Paul Gosman, who is the Superintendent of Sioux City's Community School District. And the far side, Dr. Terry Merle, who is the President at Western Iowa Tech Community College. And I want to start again by saying thank you to all three of you being with us.
We're still sitting on 3 different plans, kind of a traditional plan or an on-site plan, a virtual plan where all students would be learning virtually, and then a hybrid plan. And what we're trying to do is be responsive as customer service providers to our customers, our families, and noting that some of them are not comfortable or have medical reasons why they cannot be in schools. But that's not to say that just because a certain percentage can't be in schools, that we won't open the schools, and that we don't want the others who can safely attend in person. We're certainly hopeful we'll be able to attend in person. Right now, about 20 to 25% of our students have registered for some sort of virtual learning, and so we know that will occur.
Have you faced some of those same difficult decisions and planning scenarios, or has it been easier because you do have adults?
I don't know if it's any easier. Certainly with adults, they have issues and concerns. Just like Paul had mentioned, we've tried a multifaceted approach in trying to offer classes. So we do plan on August 25th is when our classes start. We do plan on having classes on campus. We're seeing that our online enrollment is higher than it's traditionally been. So we are seeing people opt into online. Fortunately, we have that option already. And then our face-to-face courses, this year we're offering something different. We're calling them flex courses, in that every one of our face-to-face courses is going to have an online component to it.
Joining us tonight are Dr. Larry Volz, Chief Medical Officer at Mercy One Siouxland.
And Mary Captain Dowland, the CEO at Siouxland Community Health Center. And we want to say first, thanks to both of you folks for taking time out of what we know are very busy schedules these days to be with us tonight and provide some new information and update folks in Siouxland as this vaccine appears to be on the horizon right here in Siouxland. If you could give us an idea tonight, Dr. Volz, the status tonight at our local hospitals. In the last 2 weeks or so, we've talked a lot about more cases and emergency rooms and ICUs that are approaching a capacity level. Where are we tonight?
Yeah, so I think the hospitals really are not quite as busy as we were probably a week or 10 days ago. About 10 days ago at Mercy One, we had our peak of inpatients that we've had ever since the COVID pandemic started. And that number has actually fortunately come down since that time period. And I think, ER volumes overall are down, but COVID visits, really remain pretty steady.
The public has received a lot of misinformation during the COVID pandemic and a lot of contradictory information. So there's a lot of distrust and mistrust about the safety and the efficacy of the vaccine. So our job as healthcare providers is to create that sense of trust in the vaccine, to educate people. When we hear from the experts in public health that the vaccines are safe and they're effective, then we need to make sure that we're educating our populations.
And I think those numbers, that 50% number, is disheartening. You'd hope that everyone would be all in. We know we're not going to have enough vaccine the first day to vaccinate the entire country. So hopefully, as vaccine becomes more available, that the company or the members of the community will become more comfortable getting that vaccine, seeing that, all right, people are doing okay with the vaccine, and that as more vaccine becomes available, hopefully that by the time summer rolls around, we'll be at 80 or 90% of people getting that vaccine. But if we stay at this 46% number, that will not get us to a point where we can get back to living normal lives again.
We do have a viewer-submitted question for you here. Is it true, if you have COVID-19 and have had a positive test, can you be reinfected? Of course, across the country, we've heard a few cases of potential reinfections. If you care to comment on that, because that is a serious fear for a lot of people.
Yeah, so you can be reinfected. The risk of that at this point, from all the data that we've seen, is low. But I think now, our first cases were really in March, and so now we're 9 months. Would I be shocked if we're starting to see those cases rise again? We're not sure how long that immunity from your initial infection lasts, but you can be reinfected. And so once you've been infected, you still need to maintain social distancing. It doesn't mean now that you can just get back to living however you want. We still need, and even if you were reinfected, could you transmit the virus again? We don't know those answers yet, but you can be reinfected.